Thank you guys in the studio. This panel is the second in a series of lectures dedicated to the discussion of the pandemic called Multidisciplinary Scholarship and Approaches to Health and Social Justice. This one was titled Vaccines, Public Health, and Mandates, a multidisciplinary panel presentation, sponsored by the Department of Sociology, the EXL Center, and the UA Center of Conflict Management. The panel was held virtually on October 7th at 11 a.m. on Microsoft Teams. Panelists discussed a range of issues pertaining to the community and its handle over the coronavirus protocol. Participants who got the chance to listen to this call left with not only a wealth of information, but also a new perspective on the pandemic, response, and its effect on the community, be it in the city of Akron or beyond. The presenters consisted of professionals who work at the University of Akron and in community affairs alike. Each speaker gave a presentation on a topic that garnered many questions as a means of providing an expert opinion on the topic. The first one was titled, To Boost or Not to Boost, Vaccine Efficiency and Protection Against COVID-19. This was presented by Dr. Hazel Barton, a professor and director of integrated bioscience at UA. She breaks down the purpose of the vaccine, what it does to the body, and the role it plays in protecting one from the coronavirus. The next discussion was led by Dr. Jess Otto, an assistant professor of philosophy at UA, and it was titled Vaccine Ethics, an Ethical Framework. Dr. Otto describes the ethical construct of the vaccine and its effect as both a social and political talking point and the greater good. Other discussions were led by health professionals at Summa Health, who discussed health concerns based on their experience and expertise. Dr. Ariel Hopkins, System Director of Community Relations and Diversity at Summa Health, led this discussion titled COVID-19, a Summa Health Perspective, giving a synopsis and updates on the current situation from an inside point of view, describing how the largest healthcare provider in the city has helped improve the situation. Lastly, participants got an opinion on how the vaccine is key to finally help transition the U.S. from the epicenter of the coronavirus to once again being COVID-free, in a discussion titled COVID-19 Vaccines, the Tool to End the Pandemic, presented by Dr. Thomas File Jr., a professor of internal medicine and chair in the infectious disease division at Summa Health. So, after it is all said and done, what's the takeaway from this panel? It is important to understand the reason why vaccines are so important and how it will affect the community. Vaccine requirements remain a highly debated topic that is still developing across the board. More or less, people are willing to get the vaccine if it means that they can return to a normal life. However, normal is subjective. At this point, it is important to consider that things may never return to the way they were before. The impact of the coronavirus pandemic has changed the U.S. and its citizens, socially and ethically. That is not necessarily a bad thing, as it has allowed for people to work in union against the common threat. That is truly the key to ending the pandemic. Tyreese West, Lights Camera Akron, ZTV.